Hello and welcome to the Business Solutions podcast, the show where we explore the courses, people and stories shaping learning at the University of Suffolk. Today we are talking about the new Childbirth and Parenting CPD, what it is, who it's for and the benefits of completing the course. Joining me is Emily Ruegg, who is the course lead here at the university. Welcome.
Thank you.
So Emily, could you start by telling us a little bit about yourself and your role at the University of Suffolk?
Yeah, lovely. So I've been a midwife for 20 years. I actually qualified here when it was a college, Suffolk College, many moons ago. And I've been a practicing midwife ever since. Did lots of different things during that career, kind of working in the community, in the hospital. I was a ward matron for a time. And I also worked around practice development, so training for midwives and supporting staff in their development. But just after I had my second baby, I started a community interest company that looked at antenatal education, and that really kind of sparked my interest into antenatal education and developing learning for couples going through the childbearing experience. So that's it in a nutshell. And then I joined the university during COVID, so 2021. And I, at the time, was doing a bit of both, still working in the hospital, but then fully joined a year later. And I've been a course lead for the last 2 years for the midwifery shortened programme, which is where we have nurses who want to develop into being a midwife. So that's the course I lead.
Brilliant, fabulous, and lots of experience, which is brilliant. So what inspired you to get involved with the Childbirth and Parenting CPD course?
So it's coming from lots of different places. From my clinical experience, my experience in looking at antenatal education, and then going on to do my master's, looking at factors that influence how couples experience birth, and education is just a reoccurring theme throughout that. That most couples or childbearing women are entering pregnancy and childbirth and parenting being influenced by lots of different factors, and I found that antenatal education is lacking. In the UK, we have some trusts that are doing loads and loads of antenatal education, and some that aren't doing nothing at all, and everything in between. So depending on where you are, that kind of postcode lottery, you are either getting loads of information or none at all. And then when I was doing my antenatal classes, and they were free, we tried to make it as accessible as possible at the evenings and weekends, we were still not getting a good uptake. And we know that a lot of vulnerable communities don't access antenatal education. And when it's such a big life event, actually the more you know about childbirth and parenting and feeding and things like that, actually you're more likely to have a more positive birthing experience. So, throughout my career, trying to find ways to be able to get this information accessible, where we've done it during the traditional route. We then, through COVID, decided let's go virtual, because that might, and it did for a while, get more of an audience, but it still wasn't enough. It still wasn't maybe getting the right type of information either. It's very medical, factual. It's, talking about processes rather than actually how to optimize their experiences. And that's when I started working with high schools and seeing what is actually being taught at the moment around kind of pregnancy, birth and parenting, and realise that it's not a lot. There's a massive gap there that actually that's a captured audience where children are, most of those children are there, bums in the classroom, where a captured audience where, we lose them then. And so, it's voluntary. We're not kind of saying you must listen to this. So I just thought there was a niche there that we could potentially start educating children earlier on about antenatal education, and that's kind of sparked my passion for it.
Yeah, and that's something that they will always remember and carry on throughout their lives. And as you say, because it is something that they will be listening to, and otherwise it is a voluntary thing, and who has time sometimes to be able to allow that amount of time to sit there and listen to the course. So no, that's fabulous. So for listeners who may not be familiar, what exactly is the Childbirth and Parenting CPD? So what does it actually entail?
So it's a program that's available to lots and lots of different people, but it's essentially a day course that really updates skills and information around pregnancy, birth and parenting and breastfeeding, with the aim to start thinking about our own preconceptions around birth and pregnancy, and have an opportunity to get the best available evidence-based research around those topics, because it's ever evolving. I mean, things have changed so much in the last 5 years, let alone kind of when, you know, maybe some people having babies themselves or in education themselves. So it has changed a lot. So there's an opportunity to get the best available research, looking at factors around making good decisions about pregnancy, around misconceptions around it's body autonomy. How do we, without promoting, everyone, at a young age, going out to have babies, is about how do we make sure that the future generation of childbearing people are making informed decisions. So it's around educators in that scope who might be potentially leading those conversations with children, having an opportunity to have a good source of information to be able to have those conversations.
Fab. So you said that the course is designed for the educators for this CPD. So is that just high schools that you're looking at? Who is it actually going out to?
No, I think it's open to across the kind of education field, like primary, secondary, and those that are maybe delivering more specialised kind of things like health and social care and allied health professional kind of courses. So whether that be BTEC, A levels, all across the board really. A lot of there's nowhere really apart from Google where people are getting their information about leading these conversations. So I think it's for everybody. And I think the earlier we have those conversations, the more we know about the body. I know at primary school it's more about, general anatomy and physiology and reproductive health. But I think, again, where that information is coming from and is it evidence-based, so I think it's applicable for everybody that might be having conversations with young adults or children around reproductive health.
And so those educators that you're reaching out to, is there any skills or experience that they need to have to be able to go on to this CPD course?
No, I don't think so. I think the course is really catered for complete novices. So they're coming in with no prior information, all the way to those that may be delivering more advanced kind of skills around like A levels, BTEC and things like that. I think in between that kind of spectrum, everyone would get something out of it, something, to take away with them. So I don't think you need any prior experiences, or you've just maybe got an interest in wanting to know more about it. Because actually the way that generations are birthing is having a massive impact on the education system. We're now starting to see that with behavioural issues, attention, the rise in neurodiversity. That has a link with birth. So actually, it's quite insightful when I have talked about this topic with educators. They've been really kind of blown away and thinking, God, I never made that correlation that the way that people birth actually affect their childhood, their learning, their school achievement and attainment and behavioural issues. So actually, the more, and that's a big part of the course, is actually trying to unpick some of those things of why birth is so important and why it should be in education, because it has, when we get it right, it has the power to change a whole generation for the good. It's can be really, really powerful when you look into that. And I think now we're seeing such complications around birth. We're now seeing that feeding into other systems, health, education, social services, police. It's massive.
Yeah, absolutely. So if somebody's interested in doing this course, how's it being delivered? Is it going to be online, in person, hybrid?
Yeah, so we're offering face-to-face and online as well. So lots of different ways to be able to access it, and you can ideally it's a whole day, and we'll be able to support some learning outside, so we'll be able to give you resources to then be able to follow that on when you know if you're putting this into kind of teaching how you do that.
Fabulous. And so why do you think continuing the professional development in the areas like this, why is it so important right now?
Like I say, it's so important in terms of recognising the impact that birth has, and I think recognising our own misconceptions around birth, because generally we learn about birth through our own experiences of others, and what we can Google, and that develops kind of misconceptions and misunderstanding around it. And if we haven't got anywhere to kind of go to kind of change that narrative, we might be feeding that into other future generations, particularly kind of things around kind of fear of birth, and that birth always a painful process that's really dangerous and complicated, and you're just lucky to kind of come away with, you know, being healthy. That actually it's so much more than that. And as a midwife, you're so lucky because you have 3 years of the most amazing antenatal education. So most midwives have a really positive birthing experience because they've got so much information. So I think as educators, it's so important to have evidence-based teaching that makes you reflective of your own misconceptions. And the same with parenting, that, you know, we generally kind of are led by our parents on how to parent, and you can see that, you know, research, oh, that's good, but actually bringing that all together and, you know, and starting to think about the bigger picture of how this all kind of sits together in the whole lifespan. So I think it's so important for educators to keep themselves updated, but it's really hard to do that. You know, when you're supposed to be a jack of all trades, aren't you? Being a teacher, you know, how do you get that information? So we're hoping that these kind of sessions, and then you can be a little source of information for other people within your team. You know, it doesn't necessarily need all of the whole of the teaching force to kind of go through the training. It could be a couple of people then become kind of specialised in that area that you can then kind of disseminate the rest of that information to the team.
Yeah, and as you say, it's just having that full understanding and having somebody like you that can answer questions and queries that if maybe questions that they've been asked that they haven't been confident enough to actually answer.
Yeah.
So if somebody is interested in joining the course, how would they go about doing that?
So we've got information via the university. I'm sure you would share a little bit more about that, Gemma, but yeah, they can contact me directly, or there's a link that's attached to this podcast that they can follow if they want more information.
That's brilliant. Lovely. Well, it's been absolutely lovely talking to you. And I think the CPD course is going to be absolutely amazing. And we will send out more information, and we will have the links below so that you can apply and come on to the course with Emily. Thanks ever so much.
Thank you.